as to the number of those who are hooked on drugs and substances, you would realize that if just one person in a family has a drug use problem, it brings an enormous distress to the family members, to the community, to the society in general, and of course to the development of Nigeria. So I'm excited that we're having this discussion today, and I'm sure that there are many families who are listening today who would want to ask one or two questions. True.
And you can watch us live on YouTube, Facebook, and at Eagles FM Abuja, and together let's look at the issues together. And you can also call us on the program.
Yes, you can call 090-7353-0044. 090-7353-0044. Also, you can also call 090-8766-8888. 090-8766-8888.
Okay, so you can call us, you can ask questions. Dr. Hope Omeza is the Executive Director of VGADA. Did I call that? Okay, all right. Specialist Rehabilitation Center, Abuja. He's our guest today. So, Doc, the issue of drug abuse is a major challenge to societies and authorities in Nigeria and globally, and the resultant effects have strangled a good number of our youths, reducing them to be grossly unproductive and exposing.
Because they have a monthly cycle behavior that borders around changes in their hormonal system in their body. Now, what happened is that a particular phase in their cycle add to our burden by legalizing marijuana. Now, most times we are quick to copy policies of Western countries, but we're not also careful to try to understudy the consequences of those policies in those countries, which they may not tell us. Now, but they will tell us, oh, we legalize this, we legalize this and that. Now, do we understudy what are the consequences of those policies they are implementing in those countries? And researchers have shown that some of the states in the US that legalize marijuana have seen a rise with abuse of marijuana. So these are areas of concerns for policy formulation and policy, implementation. That being said, let's look at the health consequences of marijuana use
And other drugs.
And other drugs. In fact, I have a patient whose sister told me, said, we told her the brother studies positive to marijuana, and I was like, oh, just marijuana. And I told her it's not just. I have seen most of my patients that have had severe mental illnesses upon admission or at presentation has most of the time addicted to marijuana, not even the other drugs. I've had several patients who had to be on dialysis for years, and eventually they lose their lives. And some had to be, moved abroad for kidney transplantation and the rest of the thing, which most families cannot afford.
Of course.
So these are the challenges. Do you talk about other consequences with, social consequences, relationships in the family? You talk about financial mismanagement and the rest of it, and most of other issues that are attending to drug use.
Okay. Thank you, Dr. John. I want people to call us on this program because the doctor is here. Let them call and ask questions, because the doctor will be able to answer so many of them for them.
The number to call is 090-7353-0044. 090-73.
It's an addiction, but instead of reduction, we're seeing increase in the rise for demand and use of some of these drugs. I'm wondering why it is always like that.
Well, I think I'm seeing a situation whereby it's the feeling. Is it the euphoria?
It's difficult to stop, right? Once you start. The intangible element, which is the addiction. You cannot feel it, you can't touch it. But the people who are involved and indulge in the use of these drugs, they are the ones who understand how they feel. The high. How it is. So when the addiction is already established, it is very, very difficult. Because of they want to keep on going back. They want to keep on going back all the time to have that feel. So that's why even sometimes when somebody is even trying to go through some kind of rehabilitation or some kind of treatment, you see the withdrawal symptoms. So some of them will start falling sick. and
so they want to go back
they want to
for
return.
treatment.
So some people will be physically shaking. You see them shaking, and the only thing that can bring them back to normal again will
So
be
give them the
when they
drugs.
are given the same treat again. So it's a phenomenon.
Okay, Doc, let's look at treatment and rehabilitation. You have a facility here in Abuja, right?
Yeah.
Okay, so tell us about it. What is the situation like in terms of management and treatment of people affected? Because I know when you move around, you see lots of people with signs of what will I say, consequences of drug misuse, and you see them moving around. Lots of times you see families just getting angry with the persons instead of finding help with them. Have we gotten to that point where we understood completely the need for treatment and rehabilitation?
Well, this is another area of great discussion. Has been top in their game with making arrests of those who peddle drugs and traffic drugs. Now, we must pay attention to drug demand reduction as well, which is where what you are doing now falls into that category, creating the awareness, creating necessary sensitization for policymakers who will make policies and take actions for implementation. Now, if we don't do that, you already have a teeming host of users who are addicted to it. And these people will stop at nothing to get the drugs. So they form a ready market for anyone who wants to venture into the business of selling drugs. Because you will always have the market if you don't deplete those who are hooked on this substance. It's the person who is addicted do not just want to be behaving in that manner. He is under the control of that substance. I've always said that the first time someone takes a particular drug is voluntary. He took it with all his senses, with all control, with all sense of responsibility, either for peer pressure, either for whatever reason he decided to indulge. Now, subsequently, when you see someone is addicted, that person does not have control over that
anymore.
behavior. The person is a sufferer. He is suffering. He is sick. He needs
So
to be
we should,
treated.
yes, we should look at drug users as sick
As
people.
sick people,
All
not
right.
as not don't look at it from the point of moral failure,
Yeah.
or you start blaming the parents.
Yes.
Oh, you didn't do this well, adding more anxiety and distress to the families who are associated with this person.
Okay, Doc, so what should be the right thing to do? I always think that it's better for us to prevent our young ones from entering, because once you start, it becomes difficult to stop. So give us some few tips. We're almost done with time.
Yeah.
How do we prevent our young
There's
so okay, I'm sure we'll